Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
I'm not sure about you, but when it comes to me, I'm reading articles and they all say the same thing over and over and over again. And as a clinician, this is what your patients are listening to. Unfortunately, it's the same blah, 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 blah. I'm Dr. Mitch. I'm going to give you my 2-minute take on a lot of the things that people are saying and how to maybe take them to the next step. The very first thing is that I read a quick article saying, if you want to live longer, then the answer, of course, is that you do something like keep your blood pressure under control, eat right, and exercise. Yes, that's true, no question, but it's way out of what really should be presented to these folks. There's much more important things. For example, we know for a fact that there are many studies that our biochemistry represents who and what we are and if we're going to live longer or not. A perfect example is looking at C-reactive protein high sensitivity. People that live over 100 pretty much all have one that is very normal, very low. So if we don't look at the status of our inflammation, our vitamins, our minerals, do a full comprehensive blood panel, not typical what's done in a typical PCP or in a internist's office, which just does maybe a CBC and complete metabolic profile. There is a lot going to be missed on this patient. The hormones have to be looked at. Certainly some of the nutrients like vitamin D, B12, folic acid, uric acid, whether or not there's inflammatory markers, they all need to be examined. Now, when people say, okay, just look, do this, eat differently, I tell them the following, and you could do the same. Take a look at yourself. Go to the mirror, get undressed and look at the mirror and see, do you look the same and have the same type of skin look and health look that you did 10, 15 years ago? That's the first thing. Is your hand grip as strong as it was back maybe 10 or 15 or 20 years ago? Do you have sarcopenia? The number one thing that we look at to determine if someone's getting older, meaning that is that muscles, are they getting weaker? Are they becoming more atrophied? Do they still have that youthful look and tone to them? Of course, skin turgor, you can always take your hand and pull up the skin. And if it's going to take a year and a half to go back, you know that there are already changes in the underlying collagen, and taking more collagen is not necessarily the correct answer, obviously. Can you stand on one foot pretty much and keep your eyes open for at least 20 seconds? Or is the neurological system starting to break down? And of course, can you sit on the floor? Just get up from the floor by a sitting position without using your hands. These are the questions as clinicians we need to definitely ask. The other thing is we need to ask why. Someone has blood pressure. We're not just going to Band-Aid that because that's the typical Western model. It works to a small degree, and then, of course, more and more medicines are added as the person gets older. I want to know why. If you have blood pressure now, why do you have it in the future, or why don't you get something? We get all these diseases. We need to go back to our biochemistry 101. We need to go back to physiology, the functioning of the body, and it'll give us the right answers. So don't read things just for, it's just this or that. Let's delve into it. Let's ask the questions. Why? I'm Dr. Mitch. Thank you so much for watching.